TAXINOMISIS is an EU-funded research project within the Horizon 2020 program. TAXINOMISIS aims to develop a new approach for the risk stratification of patients suffering from carotid artery disease. TAXINOMISIS includes 16 partners from 10 European Union countries. Those are partners among the top international organizations, and they are vascular surgeons, cardiologists, neurologists, biologists, but also biomedical engineers, IT experts, lab-on-chip experts. Those experts will deliver finally the platform of the TAXINOMISIS project and will contribute to the evaluation of this platform through an observational study.
We are involved in the TAXINOMISIS projects in two different ways. One is more on the basic side, verifying EV biomarkers, extravascular biomarkers in more than 1,000 patients, as well as RNA sequencing in more than 700 atherosclerotic plaques. What we think, however, is that this is a unique concept and way of combining basic science and clinic that will lead to a better treatment and risk stratification of carotid artery disease patients.
We are involved in the TAXINOMISIS project in three ways. First, we are trying to define the immune cell landscape, that means the total population of leukocytes of human carotid atherosclerotic plaques. We are using for that state-of-the-art technologies like multicolor flow cytometry and mass cytometry, or CyTOF. We are also trying to analyze the molecular profile of these plaques using RNA sequencing and also single-cell RNA sequencing to get information about the molecular processes and pathways involved. So that is an idea about the disease mechanisms involved. And finally, we are developing a new point-of-care chip for detecting single nucleotide polymorphisms. That means a chip that is applicable, useful in a point-of-care setting, so without special equipment, and which can be used to define mutations that make a patient more susceptible to side effects or less susceptible to side effects, or more appropriate for treatment with specific drugs.
The TAXINOMISIS project is coordinated by the University of Ioannina, Greece. The University of Ioannina is responsible for the computational models, the development of the software platform, and also the collection of data from the observational clinical study.
The specific challenge we have to realize at IMEC in the project is to create a miniaturized chip for detecting genetic markers. Recently, we have already developed such chips for detection of a single marker directly from clinical samples within less than 5 minutes. In the project, we want to take it one step further and instead of looking at a single marker, look at multiple, about roughly 20 markers simultaneously on a single chip. Detecting multiple markers on a single chip has of course multiple applications and benefits. In the TAXINOMISIS project, we hope that these multiple markers can be used for risk stratification, to predict the drug response, or even the risk factors related to carotid artery diseases.
As a vascular surgeon, I'm frequently faced with the decision how to treat patients with carotid artery disease and when to apply aggressive therapy and intervention of carotid endarterectomy, of carotid stenting, and when to apply medical treatment and surveillance. We are all aware in vascular community that patients with carotid artery disease are not stratified at the moment sufficiently well, and we are mostly based our decisions only on the level of the degree of carotid artery stenosis. Of course, behind the degree of stenosis, there are a lot of other morphological factors and other factors dedicated to patients that are not included in this stratification. This project will have several future benefits, hopefully, especially for the physicians and for treating doctors. This project will give us more information about those patients who are at risk to have a stroke, especially those patients who are at risk to have a stroke caused by carotid artery stenosis. Also, this project will hopefully influence the future guidelines and future decision-making processes and advise physicians which therapies to apply in every particular patient with carotid artery stenosis.
It is really a challenge to try and identify potential risk factors for future ischemic attacks among patients with intermediate to severe carotid artery stenosis. Blood samples will be collected and analyzed, genetic sequences will be investigated, ultrasound and MRI images will be processed, and full medical history will be reported in detail for every single patient recruited. This process will be repeated every year for a total of 3 years. Any new event will be reported and an intervention will be planned according to current European Society Vascular Surgery guidelines.
The challenge we have to face within the TAXINOMISIS research projects is to make the treatment better, to make the decision-making process better, and actually develop a risk stratification tool for the carotid artery disease. The main benefit of the TAXINOMISIS research project is that we can achieve a new approach in risk stratification of carotid artery disease, which is based on biology and not on the stenosis of the carotid artery. This will lend to the early identification of patients suffering from carotid artery disease, less interventions, mortality and morbidity, and also less and smaller healthcare costs.